We hope that you join us continually as we progress to do these. I would like to introduce myself firstly. My name is Haley Minter. I am new here at Impilo. We are really excited to kick off this program today by explaining to you a little bit about how to start and scale your own RPM program. So some of you may be current customers interested in joining our network or our business. So we are thrilled to talk to you more today. So firstly, I just wanted to kick off the call by introducing our presenters. So like I said, I'm new to Impilo. I am on our marketing team, specifically working in marketing and demand gen, and I will be moderating our call today, but I want to kick it off to Josh, and then we can go down the line and do some introductions.
Hello, everyone. Thank you for joining. As Haley mentioned, my name is Josh. I'm the founder and CEO of Impilo. Quick background on the company. We've been around for just over 4 years. We're primarily based in the Philadelphia area, but we have 2 warehouse locations, one in Philadelphia, one in Phoenix, and excited to be talking to you all today. Dave?
Hi, everybody. My name is Dave Sancharico. I'm on our business development team here at Impilo. Looking forward to talking to everybody today. I'll pass it along to Brittany.
Hello, my name is Brittany. I'm the Chief of Staff here at Impilo. I've been in Impilo for a little bit over a year now and have learned so much about remote patient monitoring, and I'm looking forward to sharing some of that information with you guys today.
Fantastic. Thank you to our panelists for a little bit of an introduction. I just wanted to put it out there that we would love this to be a collaborative call. So if you have any questions that pop up throughout the presentation, feel free to drop them in the chat, as well as the Q&A button, and we will have a chance to answer your questions at the end of the call. So just drop those in. We will be continuously monitoring them, but let's kick off the presentation.
So as we get into things here, I think our first question is, why are RPM programs so important? So one of the biggest topics to talk about is how accessible RPM makes for patients in rural areas, in patients where transportation is an issue. This really allows for physicians and clinicians to stay connected with their patients in between visits. Obviously, in rural areas, transportation can be a huge issue. It can be 45 minutes to an hour just for somebody to get to their primary care practice. In urban areas, transportation can be an issue. And for older patients, transportation can be a huge issue when you're talking about somebody that's dependent on a caregiver to get them from appointment to appointment or to see their primary care doctor or wherever it may be. We've talked to programs before where they have patients that come into the office. They might be using a device like an analog blood pressure monitor, and they have patients come into the office twice a month just to get those readings so they can monitor their patient's blood pressure or some other vital sign. And one of the unfortunate things about that is that they're wasting time, money, and they're asking somebody who may otherwise not be able to get themselves to a doctor's office to try and come in just so they can get a reading. So remote patient monitoring can really help to solve that problem in itself. Also, remote patient monitoring increases patient engagement. So really can help to give feedback both on behavioral things, like actually seeing things like with glucose, what spikes your glucose level. I know I can speak from experience. I've used a glucometer before to track what happened to my glucose after I ate, things like that after I ate a meal. And it's really, really insightful to see what is spiking your glucose, how long it's spiking for. And for a patient maybe that has diabetes and has never actually seen these things before, it can be a really, really good way for them to become educated, not only on their disease, but what things interact with their disease. Also, it allows for another touch point with patients in between appointments. You as a physician, a virtual care company, you may see a reading that you want to talk to your patient about in between. So it gives you a reason to contact that patient, maybe to bridge the gap in between their appointments and to keep them engaged in the ongoing conversation about their health. Next is really ties into the patient engagement, but also you get real-time data so that you can intervene quickly on things, alerting, say blood pressure is too high, blood pressure is too low, glucose spikes to an unsafe level, something like that. That can allow you to catch these issues before they become episodes that need to that escalate maybe to somebody being admitted into the hospital, readmitted into the hospital, something like that. That really ties into these last 2 points here. If you now have the ability to know what's going on with your patients and their issues while they're at home, you can now prevent them from being readmitted into the hospital. And I'm sure as many, if not all of you know, that can save thousands of dollars per each readmission. So we'd love to move on from here. So step one in building your program, step one of quite a few steps, is identifying your program's purpose. So one of the things that we really want to look at here is there a specific disease state that you'd like to monitor? So a couple of different types of programs that we see most commonly are hypertension monitoring, diabetes monitoring, and weight management. Also, COPD management, asthma management are some of the more popular programs. But then there's other things. So we see a lot of primary care offices that would like to send out virtual wellness kits. We see programs like cardiac rehab, where they're actually working with patients who are just released from the hospital. You know, maybe they had some form of cardiac surgery, something along those lines. So really the first thing, and obviously this could be dependent on kind of your specialty, maybe your primary care office, maybe your cardiac care office. This is what's going to help you decide what you would exactly like to monitor for. There's some other things to consider, like length of your program. So cardiac rehab, you might be looking at a program that is shorter duration. You know, this might be 2 weeks, it might be 6 weeks, it might be 3 months. But for something like traditional remote patient monitoring of somebody that has hypertension, this might be a program that they're on for a pretty extended period of time, if not for their entire life. And hopefully by monitoring them, being able to engage with them on consistent readings, you'll be able to positively impact their hypertension, but it can be something that needs to be managed for obviously and monitored for somebody's entire life. And then the other things to consider are you looking to optimize for revenue upfront? So that can be through CPT codes. Will you be billing directly? Will you be billing insurance for remote patient monitoring? There are codes for that cover the cost of the device monthly. They cover the cost of your management of the patient in this program. But then for some programs, they're not as concerned with billing CPT codes. They might just want to keep their patients engaged. They might want to make sure their patients are always being monitored, but not necessarily from a perspective of them trying to collect revenue from it. So there are different reasons for starting an RPM program, but certainly one of the things to keep in mind is that there are costs associated with using devices, the time associated with talking to patients about these things, ongoing costs that certainly have to be considered and can be accounted for in one way or another. So once you start considering these things, you can kind of look to the next step of your program. So next up is identifying your patient population. So a huge part of this, like we mentioned at the last point, is the conditions that you're monitoring for. So you're going to target a specific chronic condition. So this can be hypertension, diabetes, COPD, weight management. When we get further into things like sleep studies, cardiac rehab, maybe with Holter monitoring, something along those lines, but it really can vary. So depending on your specialty, depending on where you want to get started, and this can be an ongoing thing. So you might say, hey, eventually I want to monitor my patients for a bunch of different disease states. I really want to make this like a complete package, be able to do something for everybody. But I would say that one of the most common ways that we see with our customers getting started is monitoring for hypertension. It's significantly easier to do this than some of the other things. Basically, all you really need in that situation is to send out a blood pressure monitor. You can start getting readings when you use a cellular monitor right away. Whereas something like diabetes, you may have to send refills of test strips and lancets. Certainly something that can be done with relative ease. But I would say from the perspective of the easiest way to get started, usually hypertension monitoring will be that. So another thing to consider, like we mentioned before, is do you have patients that are in rural areas? You know, maybe you have a bunch of different patients in your population that have hypertension, but you really only are focused on monitoring the ones that have trouble getting to your office. So maybe you want to focus on the patients in rural areas, or maybe some of your patients are in more impoverished urban areas and they have trouble actually getting to see you or getting to their physician or something along those lines. So that might be the population you target. Really can depend, but certainly something to consider. Then the next thing is, will you rely solely on insurance billing to cover the cost of your RPM? So if that's the case, there's kind of three things to consider there. If you financially may or may not be able to do this, depending on how you're billing for it, but Medicare billing can get you around $150 a month when everything is fully covered and you're following protocols. Medicaid varies from state by state. Unfortunately, some states at this time are not even reimbursing for on Medicaid, and then some private insurance covers remote patient monitoring as well, and that can be done at different levels. So, like I mentioned before, some of our customers choose to cover these costs themselves for their patients. It may be included as some form of membership for in a virtual care program, and then some of our customers have to rely fully on RPM billing. So these are definitely different things to take into consideration on how you're going to cover the costs of the program and what patients you're going to be working with in these programs. So next, I will pass it over to Josh.
It's actually Brittany who'll take this one.
Sorry.
So step 3 is all about device selection. Choosing the right device for your program goal is crucial. You may be monitoring and managing hypertension, in which case you'll want to make sure you have a solid blood pressure monitor selected, and maybe even a wearable device for this type of program. Your options start with what we call the core 4, the blood pressure monitors, weight scales, pulse oxes, and glucometers. These are probably the more common remote monitoring devices you'll see. You can even expand further and include devices such as ECGs, activity trackers, barometers, the list goes on. If the goal of your program is weight loss, something to consider here is maybe the availability of having an extra large cuff, as not every blood pressure monitor comes with or has a compatible extra large cuff. So something to consider based on your specific patient population. The next thing to think about with your device selection is the connection type. So you've got Bluetooth or cellular, and deciding which will fit your program better. Cellular devices come with an active SIM card and transmit data within minutes of taking a reading. This will eliminate challenges for patients who may be elderly and less tech savvy, as there's no setup required. You simply open the box, take a reading, and go. Bluetooth devices are a little bit different, typically connecting to an app, and may be more beneficial for patients in areas with poor cell service. Bluetooth devices can also be used as cellular devices with the help of a device hub. Adding in a device hub connects to the devices via Bluetooth connection and can send readings via cellular. There's pros and cons for each connection type. A benefit of cellular devices is, again, there's no setup required. You just open it and go. So it's easier for elderly patients who might have a hard time setting up the device themselves. Bluetooth devices can be beneficial because of their cheaper cost. While Bluetooth requires a more tech-savvy patient for device setup, it can still be more cost-effective upfront. Next slide, please. From here, you're going to want to identify your workflow. So once you have your devices identified, how are you going to get them to your patients? Maybe you want to ship directly to the patient yourself, maybe to a site, and then distribute to patients from there. An alternative option here is to also potentially find a logistics partner that can manage this piece for you and take the worry away. Another important workflow is going to be around support. So providing support to your patients is crucial. They're going to have questions about their devices. They're going to have questions about their readings. They're going to have questions even about the program itself. What if your patients experience issues with their devices? So you'll need a plan in place for managing device issues and troubleshooting. Support workflows should also cover logistics issues. What if there's a carrier delay or a package gets lost in transit? You'll want to have a workflow documented on how to navigate any issues that come up so you're fully prepared to support your patient. Lastly, you'll want to create a clinical workflow. Is your EHR integrated with your selected devices to ensure readings come through seamlessly? How are you assigning devices in your EHR so you know which patient a reading comes from? These are all important aspects to consider prior to the implementation of a remote patient monitoring program. And we go next to step 5. You'll want to build your patient base. This is possibly the most challenging part of starting an RPM program. You'll want to start with working through a referral source. Maybe an example of this could be partnering with a hospital who refers patients to you post-discharge for at-home monitoring. Once you obtain your patient referrals, engagement is key for keeping their interest intact. An important piece to consider here is how you're reaching out to your patients. Are you calling them? Are you sending emails, maybe text messages, maybe a little bit of each? There should be a plan in place to make sure patients are aware of your program and how the program can benefit them. Your patient's experience with your program throughout the first month is extremely important. If you want to make sure your patients are set up for success from the moment they are enrolled, you're going to want to ensure their devices arrive in a timely manner, make sure they're educated on their devices, maybe include an insert or marketing material in that package so they understand how to set up and use their device, maybe navigate any error codes, things like that. Having workflows in place to manage these items is necessary to successfully implement your RPM program. Once you have your patient base established, you can then move on to billing for the services provided, which will lead us to step 6.
Awesome. Thank you, Brittany. So, a lot of people do RPM differently. Many people look to do RPM with a billing mindset. And what that means is there's a few codes out there today that allow you to kind of get a nearer term ROI on your program, on your investment. But to do that, there's a few things you have to do and make sure to get documented, as well as get the patient engaged with the device, as well as your program. So the first code that we have out there today is around actually setting patients up with the device. That code can be used one time. You can think of it almost as a welcome call, as a setup call, as a way to kind of get them started with your program. Different carriers, as well as insurers, cover different amounts, anywhere I'd say from $15 to I think $18. The second code that you have out there is around actually providing the device to the patient and getting 16 days of readings. This is by far the hardest thing for our customers and people in the industry to get on a regular basis. And therefore is why there's kind of a need to ensure that there's strong workflow, strong engagement, because if you think about it, 16 days is more than half of the month. And really, getting someone to remember, getting someone to have their device near them, getting someone to bring the device with them when they travel, things like that, can get in the way of actually being able to bill for this activity. The other aspect of this code is actually providing the device. Many people look to either buy those devices, lease those devices, rent those devices, but the key thing is providing that device. I've seen different opinions as to whether that needs to be provided to bill for this code, but at least as far as I'm aware, that is kind of the mainstream thought. And then the other two codes that are out there are around actually kind of spending time with the patient, spending time with the patient's readings, and actually managing their condition. So that could be talking to the patient about behavior change, doing med recs, engaging them about a specific reading, or doing some documentation around kind of all the kind of aspects of their chronic disease program. The one thing to note, though, there are a lot of changes coming up with these codes across the different areas of healthcare, from FQHCs to Medicare in general. So people are looking at waiving the copay, and FQHCs, for example, just got the ability to bill for this. So lots to look forward to in the next year as this continues to play out. So let's go to step 7. So step 7, this is something that our team plays less of a role in, but it's very important when running any of these programs. You have a bunch of, sick, kind of elderly folks, thinking that their device is going to be monitored at all times. And, there can be and will be concerning readings that come through. And so it's very important to kind of head on, kind of ensure that there's a plan in place to, one, receive all of these readings on a timely basis, and then also communicate to the patient how they should be expected to be monitored. Typically, a lot of our customers will create decision trees, both for their clinical and non-clinical staff, as to what to do when certain things happen. So it, allows the team to not have to, think on demand. They can kind of follow the path. Another important thing that our customers tend to do is at the start of any program that they're running, make it very clear upfront that this is not kind of a continuously monitored device, so that if there are emergencies or you're feeling ill, that you should go and contact emergency services immediately, or telling patients to make sure they take another reading, as typically, if you're wearing the device wrong, or perhaps maybe you're using a cellular device that is connected to your profile and your child steps on the device, there's going to be a huge difference in the reading, and therefore that might cause an alert. And then the last thing to think about here is, what's your alert system and how are you going to kind of get the right people alerted? And are you going to be managing these alerts on a per patient basis or on a global basis? So are you going to go in and set for Haley certain alerts versus Josh, or are you going to have kind of your global population alerts and manage from there? And then lastly, we have step 8. So this is, the big question and kind of why people come to us or kind of consult with us at the get-go of how do they really want to build their program. There's so many different decisions to make, from what device to who's going to do the clinical monitoring. Is this going to connect to your EHR? Is your clinicians going to be doing frontline support? And so you have a lot of options along the way to do buy versus build. And what we mean by that is, are you going to build your own logistics capacity, or are you going to use a partner? Are you going to build your own internal support function with your clinical team, or are you going to hire some? Are you going to build your own RPM portal, or are you going to buy something off the shelf? A lot of these different aspects, you might say this is something that is not core to our competency and look for a partner. Or you might say, we only want to be focused on this part, or we don't have the capacity for this part. We're going to look for partners. Typically, I would say, a lot of our partners in the space are more clinically focused, and they tend to kind of focus on those clinical workflows, the clinical alerting systems, and then how can they kind of best engage patients and really keep that bond and engagement strong, while looking to us and other partners in the space for extending their ability to scale up operations. And that's operations across the logistics front, the support front, and then device front. And then the last thing I'll say here is, I think one of the bigger questions or simpler questions to figure out buy or build is just scale. So we have a lot of people who come to us in the early days of RPM, and they have one device out there in the field, or they maybe have 10 devices and there's no plan to expand. Typically we will tell those customers that maybe it's just not the right fit for us today, because you won't have the ROI to invest in a program and a platform like us. However, if you're on this expansion mindset and have a roadmap or a big payer contract, or just invested in a new portal to kind of go after RPM, and then it truly starts to make sense to invest in a partner or invest in building out some capabilities yourself. So with that said, I think that's all we have today for presenting. We're going to do a little bit of a Q&A right now. So give us a second to kind of go through those questions. Haley, I don't know if you've already been able to pull some up.
Most definitely. Thank you to all of our panelists again, and thank you everyone for joining. Like Josh mentioned, we have a couple minutes for Q&A, so feel free to ask any and all questions, whether that be presentation specific, RPM program specific, or just about Impilo in general. While we wait for some of those questions to come in, feel free to connect with the 4 of us on LinkedIn. We would love to have you in our network, as we're constantly sharing content. With that being said, our January newsletter is going out tomorrow, so keep an eye out for that, as well as an email that will come through either late today or early tomorrow morning with a link to this recording. Feel free to share it with any of your colleagues that are interested in learning more about the program. And as always, feel free to reach out to the email listed on your screen if you have any further questions, or reach out to your account manager. But we have some questions coming in, so we will answer these live. Our first question is from Julie Ross, stating, are there potential funding sources or reimbursement options for implementing an RPM program?
I can take that question. And one thing before I answer, I just want to say is for our attendees, we are planning to hold a bunch of additional webinars where we'll go into these different steps of creating your RPM program and really deep dive, in the logistics side, in the support side, in the, data management side. So as you have more questions, hopefully we'll continue to answer them. As far as potential funding sources or reimbursement options for RPM, as Dave highlighted previously, it really depends on your population and what your structure is. So we work with a few ACOs where the thought is that they're really looking at quality measures, and for example, there's a controlling hypertension quality measure. And they're not looking to get reimbursed for this upfront, but they're looking to hit that quality measure and get a reimbursement that way. We have other customers that are looking more from billing from a fee-for-service perspective. So Medicare covers these 4 CPT codes that I had mentioned in the slide before. So Medicare patients typically are the most common patients that are being put into these programs. There's, as depends on where, which carrier you're on, it's about $150 per patient per month. And then the last area I would say for funding, we've seen a lot of our customers more on the FQHC side, so federally qualified health system side, get grant funding to start programs around RPM. And a lot of that obviously came in the earlier days of the pandemic, but we're still seeing other kind of state-based FQHC programs or rural health partnerships investing in RPM.
Great, thank you, Josh. We have another question. This attendee would like to know, do you have your own clinical and patient-facing platform, or do you partner with other companies?
It's a great question. So as far as our platform, I would say our bread and butter is this kind of what we call device management and device operations. And that really covers kind of those, operational elements to getting your workflows off the ground. With that said, it's hard to ignore the clinical pieces of RPM as you are kind of managing patients in the field. And so we've built specific modules around managing the clinical nature of these different patient populations, whether that's documenting time for RPM or documenting notes more generally about the patient. And we'd be happy for anyone who's interested to schedule a demo and walk them through that. And then as far as the patient side, we have built patient-facing app, which can be white labeled by our customers. It's both a web application as well as a mobile app, and that can be used to kind of review your data as a patient as well as request support.
Awesome. Thank you, Josh. We have one final question to wrap up the call today, and that is, how do RPM programs enhance the collaboration between healthcare providers and their patients?
All right, I can take this one as well. So I think what we've seen over the kind of course of our different customer segments is, RPM is both a tool for chronic disease management as well as a tool really to keep patients just engaged. And it's another kind of touch point to remember to kind of talk to your doctor or talk to your provider, or talk to your health coach. So for example, in less of kind of a medical setting, but more in terms of a fitness, weight management setting, we have plenty of customers that really use the scale as just a way to kind of, communicate between the health coach and the patient. And we've seen just by adding that touch point, it adds a lot more kind of personalization to the program, as when the health coach is reaching out to the patient, they know a little bit more about the patient, what they were doing today, things like that. And then in addition to that, the more touch points you get with the patient, you're getting to learn a little bit more about kind of their daily lifestyle. They might have had a high reading for blood pressure, that might have been a false positive, but you learn that they were exercising, which is potentially a really good thing, or potentially not a good thing if they're not supposed to be exercising. So this, beyond just, being a reimbursable activity, as well as an activity that can lead to hopefully better outcomes. It's an activity that we've seen enhance the, patient-doctor, patient-nurse relationship. Yeah.
Great. Thank you, Josh. That wraps up our questions for today. So like just Josh touched on, keep an eye out for some content that's going to be released down the line. We are so excited for our next webinar. And I know Josh has one more thing that he wants to plug before we end the call today.
Yeah, I just saw another question come in quickly. So they asked specifically about our logistical certifications. So from an FDA perspective, just the pure distribution of medical equipment requires a registration, as well as what's called a quality management system to be in place to be able to handle these devices. That's something that we've done, and we have. From an ISO perspective, there's different ISO certifications out there, whether it be on the IT side or more on the physical process side. For us, we're very focused on an ISO standard called ISO 13485, which is for the handling of medical devices. So it's something that we've adopted policy-wise, and we've done an internal audit, and we're hopefully expecting to pass our future external audit this quarter. So thank you all for all the questions. And as Haley said, please link in with us on LinkedIn. We'll be sending out a follow-up email with the recording, as well as the documents from today. Haley, I don't know if Dave or Brittany, is there anything else you guys want to add?
Nothing else. I just appreciate everybody's time today.
All right.
Yeah, thanks so much.
Thank
We
you.
hope to see you next month.
Sounds good. Bye-bye.